Welcome back, everyone. Welcome to this final session of the NEED Symposium. We now have around 45 minutes time to have a conversation with our very special guests who are joining us today, who represent what I think are very important and also very complementary points of view, but you'll judge by yourself. And we'll be talking about the integration of unmet needs in the innovation ecosystem. So earlier this morning and this afternoon, I think you've heard all about the beginnings of the NEED project, some of the technical aspects, the framework, the database. You've heard about its implementation in the case of psychotic disorders. And now what we want to do is to take a step further and reflect on how a needs assessment framework, like the one that we have developed, could be used in a variety of public health fields. I think you've been waiting for that because we've already had quite a few questions on it. So we want to consider the potential benefits, but also reflect on some of the challenges. So it's my pleasure to introduce the panelists. So joining us today, we have Dr. Moredreck Chibi, who is the Public Health Innovation Lead at WHO Europe, with over 20 years of experience in research, development, and innovation management. He dedicated his career to developing and implementing innovative solutions for global health challenges in very diverse contexts. Thank you very much for being here.
Thank you.
Yeah, wherever you want. That's good. And now please welcome Claudia Louati, who is the head of policy at the European Patient Forum. The EPF acts as an intermediary between the patient community and EU policymakers. I think you'll be better off coming this way. Sorry. Within this organization, Claudia leads the policy and advocacy work and steers the organization's engagement with the EU and other international stakeholders. Thank you, Claudia. We're also very happy to have Marcus Guardian, who's the General Manager of the International Horizon Scanning Initiative and is regarded as one of the key architects of the European HTA system through his previous work with EU and ETA. So under his leadership, the International Horizon Scanning Initiative created a global database of pharmaceuticals in development to give countries early and reliable insights into upcoming medicines, thereby strengthening negotiation power and enhancing healthcare preparedness. Welcome.
Thank you.
And finally, we're very happy to be joined by Jorge Gonzalez, who's the director of Ticbiomed, which is a Spanish association that promotes demand-driven innovation across Europe. It currently participates in several EU projects that help organizations to identify needs, to co-create solutions to address these needs, and to achieve, in his words, the almost impossible, that is, to adopt the successful results. My name is Claudia Schoenborn. I'm one of the researchers in the NEED team here at KCE. So just before we start, a little bit of practicalities. So we have 30 minutes that are reserved for the debate here on the stage. And then we'll open up to questions, maximum of 15 minutes to the audience. So again, if you're online, post a question on the chat. And if you're here, just raise your hand. All right, so let's get started. I'd like to address this first question to Claudia in order to start the conversation from the patient perspective. In your field of patient advocacy, could you explain the importance of identifying unmet needs?
Yeah, of course. So for us, it's very important, and perhaps just a few words about EPF indeed. So we are an umbrella organization active at EU level. We represent patient organizations across Europe and across disease areas. So we are across diseases. Our members are either national coalitions of patients or European disease-specific umbrellas. So for us, we have this broader perspective across diseases. And from our perspective, it's very important that the innovation that is put on the market and that is being developed actually addresses the patient's needs. But the patient's needs as defined from the patient perspective as well. well. So we're advocating really for patient involvement across the life cycle of medicines. So from the initial aspects of defining the unmet needs to the research and development towards the regulatory approval, and then of course the health technology assessment. And I think this is perhaps what's missing as well, is that at some point there is a bit of a disconnect between the innovation that is put on the market, what is paid for, which is very often still very much driven by the money, where the money is, versus what the patient's real needs are. And so for us, we've been active on a variety of dossiers. The latest one was the pharmaceutical legislation, where this debate around the definition of an unmet medical need really came to the fore. And for us, it was very important that we have a broad framework, at least, to defining the needs, and that patients are really part of those discussions.
Yeah. Thank you very much. And moving on to a kind of broader policy level, I'm looking at Mo. You're taking the lead through WHO in fostering needs-driven innovation in Europe. So what is the relevance of assessing unmet needs in this context, and also how is it currently done?
No, thank you so much, and my appreciation for inviting me to this very, very interesting. I've been sitting by the corner there following the discussions. I was really, really impressed with the insights and all the work that has been put into this initiative. So in WHO European region, as you may know, we are in a new sort of paradigm where we are redefining public health. And we are reimagining public health in the sense that we are forced basically to do that, given the context in which we are operating in, with all the budget cuts, but at the same time we are seeing all these increasing public health challenges, to some extent converging. We're talking of conflicts, but emergencies, rising non-communicable diseases. And where we see is the widening implementation gap between breakthrough innovation and their sustainable scaling at population level. And the reason for this gap, if you dig a little bit deeper, you realize that many of these innovations, they are developed from a supply point of view. And there is a mismatch in terms of addressing some of these priority pain points that member states or even ministries of health are battling with. And for us, it's very important. It's very important now to sort of give direction to the innovation ecosystem space, to say these are the priority health needs. We can align policies, because we know innovators, their interest is quick market entry, but sometimes there's a mismatch with public health goals. And if we can have an alignment of these incentives, we can build trust in bringing even these innovators to understand our priority needs. I think half of our problem that we are talking about is that I can expand more as we are going on, but just to say this was a very great initiative.
Thank you so much. I think you're really adding some novelty here today, looking at this from this perspective. And the implementation gap you're talking about sounds quite substantive, and I think we're going to talk about it later again. Okay, so let's now hear from Marcus on how you contribute with the International Horizon Scanning Initiative to assessing unmet needs to drive innovation.
First of all, thank you for the opportunity to be here, and it's great to see so many familiar faces and new ones. So the International Horizon Scanning Initiative is a data provider to its member organizations, which is member states, and we provide hard data on pharmaceutical products that are 12 to 15 years out in the development. Anything as of trial 1, we pick up and gather in a database and build intelligence for our members, be they payer organization, be they HTA, or policy members. And from that perspective, of course, what we do and where we try to support identifying unmet need is we basically do the negative search. So we look at the vast ocean out there, and we can see where development is happening. We can see where we have clusters of emerging new drug classes, new hotspots. But we equally can look at where we do not see any development, and that is sort of a new phase for us. We haven't done that extensively, and this is something, of course, where we already reached out to the team of need, and I think this is where a great collaboration area can be established. And I think this is also a good starting point to inform policymakers, as Mo said, to initiate more investment for incentives.
Great, thank you so much. I really like this idea of looking at the negative, as you say, as in shedding light on what's invisible, and it's probably an exercise which we must do more, and definitely resonates with us. So moving on to Jorge, you have developed a very interesting innovation model, if I can call it that, which allows to directly connect the unmet needs at organizational level with innovative solutions. Do you want to tell us a little bit about how you think that the framework and the database developed by NEED could support your organization and its missions?
Right, well, thank you very much for having me. Our model is that we first identify an unmet need, and rather than giving to the policymakers, we try to connect that unmet need with startups and SMEs, especially in the digital space, where we support the open innovation, the demand-driven innovation, where the healthcare organization together with the digital company work together in a solution. So that's why for us, identifying unmet needs is so important, because Mo was saying that maybe the companies go for the quick buck, so to say, but the thing is that sometimes they don't know the real needs. You know, they think that, and the problem is that usually the unmet need that they pick is not the right one. So coming from the demand side and putting the light on the right spots is critical, because especially for the very young startups. So that's why it's so important to the work that you guys are doing, to help the entrepreneur community to thrive. Because the problem is that they develop the solution and then they crash because there is no market, because they think that the problem was worthy and it was not, while at the same time there are so many worthy problems that they don't address.
Can I just ask, why do you then say that they picked a problem which wasn't the right one?
Because most of them, or a lot of them, they focus on technology. They are geeks, so to say. And they don't speak with the customer at the end, because they are also engineers, so they want to do the super perfect product and then reach the market. And then they realize that the market doesn't want that, and they have to spend all the gasoline while developing the project, and then they cannot survive. So this early dialogue, also because it's not easy to talk with public organizations, with big organizations. They don't know how to navigate the system. So putting clearly the unmet needs and in front of them and saying, okay, these are the organizations with these needs, is really gold for them.
Yeah, would you like to react, I was thinking, Mo, on where you see the potential usefulness for NEED?
No, I mean, you have hit the nail on the head. I mean, I totally agree that sometimes it's easy to put some sort of a blame on the innovators. They are doing the best that they can within the resources and information that they have. If us as global health players or even ministries of health are not even opening up this space for interaction with these with the innovation ecosystem, I think we are setting ourselves for failure. And this is exactly why I was very happy to hear the Minister of Health this morning explicitly mentioning the regional strategy that WHO Europe has developed on harnessing innovation for public health. What it basically means is this regional strategy, member states are saying we are opening our arms. We really want to co-create solutions with the innovation ecosystem that serve public health needs. How that is going to take place, this is where the needs symposium or the needs initiatives coming in to guide that process. But otherwise, the vision, the mission is there. So I think the buck is now on the public health authorities, the Ministry of Health, initiatives like this one, really to work hand in hand to stimulate that dynamic partnership. And maybe just to mention that at WHO in the European region, we have just published a call of expression of interest to invite innovation institutions, including government authorities. Come, let's co-create solutions. These are the needs that we want that are actually affecting our region disproportionately. Can we work together like what Jorge is doing at micro level? And this can be done at regional level. And that's why I was actually inviting him to be part of this, to shape how these discussions are going to take place. So I think we are in the right direction in this respect. Thanks.
Yeah, if I can just react to that. No, I mean, I definitely agree. I think the great thing about your project is that is this multi-stakeholder approach as well, and you work with patient organizations to try to assess, also to integrate their perspective into this identification of needs, and starting this debate, around the need to drive innovation to where it actually works. I think we are at a moment where we hear a lot about competitiveness and about innovation, the need for innovation, and all of that is great, but in the end we also need to think about the access. We also need to make sure, that we don't develop products for the sake of developing products, and that they reach actually the people that really need them. So putting that at the heart of what you're saying, because it's great that public health organizations are talking to innovators and talking to companies, but they can't do that in a vacuum. It has to be a multi-stakeholder approach, and patients have to be part of this discussion to help identify those needs, and then make sure at the end, that they're actually the ones that access that need-driven innovation.
I think you're raising a very important point. And of course, the more we move up, I guess, in policy decisions, the more we'll forget about the actual patients, putting them at the center of policies. So I think it sounds like I think what you're saying also, Mo, is really encouraging, that there is actually a global movement, there is a force, there is really a motivation to move towards a common objective. Of course, we also recognize that there are many challenges ahead, many limitations. And so my next question is, what further developments do you believe are necessary for tools like NEED to be widely adopted? So I was thinking, first, let's hear from you, Marcus. You've had the great experience of developing the Horizon Scanning Initiative. So you maybe can tell us a little bit about your experience and about what you think.
I think the goal and the steps that have been taken already now and the results of NEED are quite outstanding and quite unique. And so it's difficult to compare that with others. The experience that I can share is that there's always this balance that you need to find between quality of a product, the quantity of a product, the accessibility, the usability, the timeliness of the availability of that product, and bringing all those elements together while not losing momentum is always a challenge, and you sort of have to balance them out. And finding the right partners is absolutely key. So if I can give one advice, don't do it. If you can, don't do it alone. Find partners, strategic partners that can help you push forward. And you have amazing partners here on the stage. So I think that's a good start, right? So, but keeping that alive and keeping the focus on all of these aspects, because I mean, I'm very much looking forward to find the possibility to link your amazing data sets with our database and sort of be able to reference them in our data sets. And of course, I can't wait to see more and more of those coming online, right? So that is, we would love that, but we understand that this is, of course, the depth and the quality and the richness of the data you provide is just so outstanding. And this is, of course, why it takes time. But in that time moment, of course, I think that would be the biggest risk, sort of. That's what we've seen, right? So in the development of our database, we had tremendous support of member states and tremendous support of ministries, and they were patient with us. And that patience you need to communicate, because you can't set it up in a year or two. It takes time.
Thank you, Marcus. I think the feeling is certainly mutual. So we're also really looking forward to being able to use your data. I think you also really put your finger on one of our biggest challenges, which is, of course, the quantity of entries. As you've seen this morning, as you say, I mean, for each disease, we have an incredible richness, and it's also been, some of the questions asked by the panel. What about more? And many diseases, there are thousands and thousands. So we're aware of that, and I think, one of the solutions is clearly collaborative work. So it must be collaborative with other research teams, partnerships, getting support, etc. So thank you for that. I was also thinking, Jorge, your perspective really interests us a lot because you tackle the whole innovation life cycle. So what would you say are crucial developments, in your opinion, or changes which we must aim for in order for tools like NEED to become widely adopted?
Okay, I see that how you could exploit the NEED work and database is like two branches. One is policy, and I personally I'm very surprised. I'm very happy to see that you had the ministry. So something good you are doing, because that's not so easy. And I think that the policy has been discussed today, and you are doing well. But the second branch, which is having people, especially, my field is entrepreneurs, like digital health guys, like the small guys, the underdogs sometimes, to collaborate with them to provide solutions, because at the end of the day, especially in the digital, okay, not so much pharma, not so much medtech, but especially in the digital, there are so many people willing to do good with great technologies, but they don't know where to start. So if you collaborate with them, if you bring them together, if you make the matchmake between the people, the healthcare organizations, the patients with the needs, and these geeks that want to save the world, I mean, that can be unstoppable because it's such a win-win. And really, money should not be the problem. There is so much money for innovation. We were talking about that the FP10 is going to almost double the budget. The problem is not money. The problem is that there is no communication between the two. So brokering and to put in value the database, the findings that you have found, for us it has a huge potential, and we are very happy to help, if possible. Yeah.
Thank you so much. Claudia, what is your take on this? What are, in your opinion, the biggest challenges we face, and any suggestion on how we can address them?
Yeah, I mean, as you said, I think it's the quantity of information that is needed, as has been said. I think it's also a systemic change that is needed, and at the end of the day, I think we still live in very capitalistic societies, where in the end, like the commercial interests and the public health interests often have to match, and this is a bigger challenge that needs to be addressed, which obviously is not going to happen overnight. But I think we're in times, of limited money available, and so I think everybody has an interest to go around the table and try to find solutions in order to ensure that the money that we have, that is certainly not going to grow at this moment, is actually allocated to where it makes the most sense. So for me, it's about raising awareness of those types of initiatives, potentially, of course, exchanges best practices, with other countries, see how they do it, to try to influence the culture at the end of the day, and the behaviors of all the actors that are involved in those discussions.
Thank you for pointing that out, the big system change which we need, which is, certainly uncomfortable to think about because it reminds us of all the work that still needs to be done. But maybe on a positive note, the fact that we're, all here and is a demonstration of the collective determination that we have to tackle these difficulties. Maybe to finish, is there anything you would like to add, Mo, to this, on any of the challenges ahead?
To be honest, I really appreciated this discussion, and it's quite timely. I'm an optimist. Normally, challenges, I don't normally use that term. Maybe I see the glass as half full. But the crunch of the matter is we have stakeholders that we need to align towards a common vision, common goal. And I've been talking about the innovators, what are their interests? How can we align incentives in making sure that we have a shared goal, while they are also achieving their own specific goals? Because to run a business, you need a sustainable business model that will guarantee survival of your business. So that's number one. Number two is issue around trust. I think we really need to start thinking, how can we build trust across the entire ecosystem? Yes, we have these needs, but in terms of stimulating solutions to address those needs, how do we start even building trust? These dynamic partnership, bring these innovators together and making sure that they also drive towards addressing those specific needs. That's also a very, very important challenge that we need to tackle head on. And like I said, now we are thinking on how to do that. That's why even WHO is coming up with all these initiatives, basically to address that. The other point is around equitable scaling. We haven't really touched on that. If I'm an innovator, yes, I've identified that there is a need. I know that you guys, you would want me to address, you have all these incentives, but I know there are systemic scaling bottlenecks in countries. Talk of reinvestment models, talk of innovative procurement mechanism, talk of training of some of the health workers to use the next generation innovation, talk of integration of some of these solutions as part of the routine, development of clinical guidelines so that these solutions are part of the routine. These are the frustrations that some of these innovators are facing. And let's face it. So I think this holistic approach and being so deliberate in moving the need towards this direction, having identified the need, bring all these partners together and addressing these systemic challenges, bottlenecks for scaling. I think if we can move in that direction, for me, that would be good.
Thank you so much, Mo. So I think we've had the 30-minute kind of over. So if there are any questions from the audience or on the chat.
Hi. There's, I think need really helps to identify what the needs are, which sometimes people don't know themselves, but what everybody indicates a little bit is that sometimes not the right needs are addressed. So what was already said in the beginning of the symposium, and I think what is crucial is to identify the priorities. And priorities could be very different for the different stakeholders. So maybe in general, or some of you, how do you think what's the best way to address these priorities and to make sure you capture them for the different stakeholders, but because they can be completely different, and then the priorities for the company or for policy could be different than for patients, and then the wrong need is addressed.
Does somebody want to go? Yeah.
I can take it. So my opinion is that in healthcare there are thousands of millions of unmet needs. The thing is that only 0.00001% will have traction at the end of the day for several reasons, because the healthcare organization will take up, because they are really aligned, because so many reasons. So for me, what we say is that we have seen so many good projects that they go directly to the valley of death right after having the good results. So you need to start from the beginning. Is this the need that is going to have traction? Because you will start thinking, will be there someone paying for that? Will be there, can it scale? Super important, can it scale? So you need to focus and prioritize. In our case, we prioritize in terms of future uptake. That is a criterion. Maybe there's another criterion, but what for us is very frustrating is to see that so much public money, so much effort, so much opportunity costs go to the trust, because people didn't think at the very beginning that was going to have a future. And that's how we and Ticbiomed prioritize, but of course there can be other criteria for doing that.
I think this dimension is super important, and I mean, we haven't yet anyway managed to include that in our work, but the probability of acting upon a need is, of course, something that's very important, and I think Valérie kind of touched upon it in her presentation. Sorry, you're there. In terms of, there are diseases for which there's been billions that have already gone into it without much result, and so there's also that question, of course, what is the chance of getting a result, and the result that can actually be implemented, as you say, which is even one step further. So we need to think about all of this. Yeah. Any other questions? Okay, on the chat, apparently.
Yes, there's a question in the chat. Given that 70% of our health is linked to our lifestyle and environment, and only 30% is linked to our healthcare system, don't you think that it's not up to companies to find solutions, but rather up to the government to develop public health measures that improve the environment and lifestyle?
Go ahead, Claudia.
Yeah, of course, there is a big part of this. I mean, prevention is definitely something that needs to be put on the agenda, and much more than we're doing it at the moment. Our systems are still too reactive, compared to the part that could be done before, So that's definitely a big part of the question. But in the end, I think in terms of how you manage the healthcare systems, you still have to put a lot of resources into making sure that the people that need the access to the healthcare systems and to healthcare have access to healthcare. So we also, and this is where, we need to find the different choices, make the different choices, and ensure that it's funded in a proper way. So of course you can upstream a lot of the investment, but you also need to think about the downstream aspect.
Maybe, if I may add to that, I couldn't agree more. I think with that question, and I think also in my mind anyway, when we're talking about innovation, it's not necessarily pharmaceutical innovation, and it's. I mean, I know innovation maybe yes, but what we do with need is not directly geared at producing more or inventing more things. It's also about doing the things that we already do better. It's about equality of access of what is already existing. It's about using the resources we have in a better way, and that's why we also have an indicator which is prevention, and we actually lay great importance on that indicator, because completely agree. I mean, so many diseases today are actually caused by our environment and externalities of other areas and other sectors. So I think the solutions also don't only lie within the health sector, but we need to go broader. Yeah, Mo?
Maybe also just a quick one. If you look at the public health system, or even health systems in general, the model of care or delivering care, it's very much volume driven. You know, if I'm a doctor, the more patients I see, the more money I get, and the more they come back having failed in there, the more money I get. So it's more like I'm promoted or I'm remunerated more in seeing many patients, even if they are revisiting. So there is no incentive for outcome-based, care, which I think there are countries that, especially in the Nordic countries, where they are actually pushing for outcome-based remuneration. Because that also means these caregivers are naturally forced to come up or even to integrate solutions, preventive solutions, that make sure there is health outcome more than just curative, I think.
Yeah. You just need to be careful not to select the healthiest patients. But totally agree.
Yeah.
Yeah. Any other questions on the chat, maybe? Or?
I would like to, if I may, because I said that there was a lot of money, and Claudia said there's not a lot of money. Let me explain that, because fortunately, we are both right. I mean, there is a lot of money for research and innovation. There is not so much money for health. So what happens now is that, and that the opportunity comes maybe that, for example, we are running a project where we match this unmet needs healthcare organization with companies, and we pay a check of 60,000 euros for the company to do the research. Okay, so it's called InnoMatch. You can ask me later. But the point is that there is now in FP10, if you know the name, the next Horizon Europe, it's going to have more money for research and innovation. But a model that you can have is because you have less money than. You have much less money than SMEs and startups, is that you can put the need on the table and say, who wants to come with me? And then it's the SME or the startup that asks for the money and drags you and gets you money, while at the same time they address your unmet need. So there is a huge opportunity not also in innovate in the innovation approach, where you leverage all that money that is in research and innovation to make it first work for your need, and second, get paid for doing so. Yeah. So I see opportunities, but you need to, play the system, so to say.
Making the money works wherever it is.
And that's about connecting the dots as well. I mean, you mentioned some of the barriers to innovation. Like, will the innovation actually be taken up in the healthcare system? Do we have the right skills for doctors to be able to use the new products, etc.? So it's about, of course, identifying the needs, but then also identifying the barriers afterwards, and ensuring, that you don't put all the money on the research, and then afterwards it doesn't actually reach the patients or the organizations that need it.
Mm.
And I think Jorge was also talking about once you even have an innovation, that it doesn't necessarily then get applied, and that there are barriers even at the later stage of implementation because of resistance to change or...
No money. I mean, for me, it's the hardest problem. In our experience, the innovation challenges with technology, they get solved. Again, I'm talking about digital, okay, not so much things. The problem is that then there is this valley of death, because there are perverse incentives, because there's no governance, so on and so forth. And then at the end, you just get it, there is nothing. And then all the work and so on is wasted. So if we are smart, sometimes it's not about more money, it's about being smarter in the management of the innovation. So, but again, there are ways to do that. So I also want to be optimistic on that if we are smart enough, we can make it. We can make it.
Good.
Nice. Shall we conclude? Yeah. So maybe just to finish, I wanted to ask each of you just to leave us with a final thought, recommendation, takeaway for the audience. Let's start with you, Marcus.
keep on doing what you do. I think that really shows a super great potential, and from our side, we really look forward to more integrated collaboration. But I think make use of the amazing potential you just have here, and I'm sure also throughout the day. There's a lot to be done. Thank you.
Thank you so much. Jorge?
Okay, I'm going to put pressure on the NEET project. For me, it's almost a moral obligation to exploit the work you have done. There are a lot of opportunities to do that in the policy, but also in the pure innovation stage. So I cannot do more less than encourage you to do the next step, which is that putting that in value. Because there is opportunities, there are a lot of things that you guys can do. So please do it.
Thank you so much.
Well, for me, it's continue working with patients and with patient organizations to really put them at the center of the system at the end of the day. Again, there is no point in having innovation if it doesn't serve people's needs. So I think this is really key.
Point taken. Thank you.
Yeah, I think it's now time for quantum leaps. You have demonstrated that this is a noble initiative. Partner with organizations like WHO. Let's show it to the rest of the region and beyond. And we are here to be exploited.
Thank you. Will be pleasure. Thank you very much. Really huge thank you for all of you. 2 of you even came from abroad, so thank you for making it here. And yeah, I'll pass the floor to Irina for some final words. Thank you.
Can we have a picture? That's, oh, yeah, I want a picture. I want a picture. Yes, Marcus.
Oh, sorry.
Yes, justice for.
He's an influencer. So sorry for this, guys.
Thank you.
Thank you.
Thank you.
Thank you.
Really nice.
Thank you so much. This was such an excellent panel. I'm really glad that we invited so good people, high-level people. So thank you very much for that. So today we've heard a lot about what NEET has done, but actually you only heard part of it because we didn't have time to explain everything that we did until now. But I think that we can be happy to have achieved what we have achieved until now, and we were also extremely happy to have this excellent panel to hear also from other researchers, other organizations that are really promoting evidence-based policy about their perspectives on this approach. And I heard a lot of support, which is very encouraging, of course, and evil that we have a moral duty to continue this work. So, of course, a lot will depend on other people's willingness to pay and resources. So that's another point that we have to address. So I would like to close this symposium by saying that we've done a lot of basic research actually in this context of the NEET project, and we think that this was really important to really set the solid basis, solid scientific basis for the next steps that we will have to take. It's important to take these steps, building a scientific protocol, scientific approach, building these tools in order to ensure that if these tools are being used in the future, they can guarantee that we have data that are reliable, trustworthy, and not amenable to manipulation or bias. But of course, we realize that all of this work is maybe a necessary condition, but not a sufficient condition for actual implementation and changing the policy towards more evidence-based policy. So we know, we've seen that in the past a lot, that just providing evidence is not sufficient to create evidence-based policy. We need to take a step further, and it has been stressed a lot by the panelists. I think I totally agree with that. But I think that we had to take these first steps before we could continue. And so we are really motivated, and I think all the entire NEED team is ambitious enough to make these next steps in the future. I think that we also need to stimulate stakeholders, other researchers, companies, policymakers to start using the NEED approach, the NEED protocol, and the NEED tools, be it for identifying opportunities for innovation procurement, or health technology developers or researchers that would like to measure the unmet needs they want to address with their innovations. And also regulators and HTA bodies to include this in their regular procedures for assessing new health technologies. If regulators and HTA bodies would include this as a requirement, so the provision of NEED data as a requirement in their dossier, then the decision-making process will become much more needs-driven than it is currently. And that might imply some courageous decisions as well. So if you have a company that comes with a new product without this evidence on unmet needs, and then just claims we are meeting an unmet need based on another type of data that are really not so sure in terms of quality, then it should be able to say no also to reimbursement. But now we are ready for the next steps. I think this is something that has to be taken on the international level, because of course innovation in healthcare is not a national competency, it's also something that happens on the international level. So we would like to engage with other European partners, as suggested by Marcus. I think we were thinking already along these lines, to really roll out this NEED approach and develop support to policymakers in Europe to integrate this needs-driven approach in their decision-making processes. And we also think that, because everything is about competitiveness nowadays, we think that by using this approach, by focusing on the real high unmet needs from the patient's point of view or from the societal point of view, it could increase European competitiveness. We see artificial intelligence coming. It's going to change the healthcare system enormously. We don't know yet how, but we know that there will always be unmet health-related needs, and maybe AI will even create additional unmet health-related needs. And you need a way to identify these and objectify these. What else have I heard? I think innovation gaps. Indeed, I think that, we should really have the reflection to look at the IC database to see, okay, we have identified the unmet needs, but maybe there are many products in the pipeline, and I am using already the IC database to check whether for a specific indication what is in the pipeline, and sometimes it's really, it's amazing. You are really, very surprised sometimes about how many products are in the pipeline for the same indication. So this is not really spending resources efficiently, and this is private resources, but also private resources should be spent efficiently, especially in the healthcare sector, I would say. Then the balancing of the quality, quantity of a product like the NEED database, and finding strategic partners, don't lose the momentum, and ensure sustainability of the system. This is something I take away also from the panel. The holistic approach, the importance of the holistic approach to address systemic challenges. And also this aspect of uptake. I think this is also something we should really work on, because indeed, as I said, providing just the evidence is not going to change anything. So you need an implementation approach and a strategy for real implementation. And then I also want to come back to something that the minister said this morning. We should not be afraid of being marketeers of our approach. And it was also addressed by the panelists. I think Maybe that's not our core business. We are not so used to that, but maybe we should try to be a bit more marketeers. And yeah, in that sense, I think we are trying to network, and we were very glad that these people were willing to come here for the panel. This is a good first step, but there is much more to do. We are quite aware of that. And with this, I would like to close the symposium. So thank you all for your attendance, and even after the coffee break, because I see that some people have left already. I really would like to thank also the organizers and all the people who assisted us in making this a fluent symposium. And we really hope to see you again in the future when maybe the Belgian initiative has become an EU initiative. Because as you know, in end of 2026, the Belgian funding will stop, but we hope to find some new funding, European funding, maybe to continue this work. So yeah, in the meantime, I would say take care, safe journey back home, and especially for those who still have to travel. Thank you very much for your attention.